go ahead and get started. I'm actually going to start on a sad note, and I think many of you know there was an airplane accident last night, and two of our local people, were killed in that accident. And Brad Lefevre and Chad Burton were the two, and so let's just do a moment of silence for their families. Okay, we got quite a few things on the agenda here, and it looks like it says skit, so let's see what the skit is. Go ahead.
Another meeting! Meetings! Every CEO wants to put their stamp on this organization through a consultant with more meetings!
We've been hardwired, we've been wireless, we've been Six Sigma-fied, we've been siloized, we've been leaned, we've been meaned, and you know what? The more things change,
The more they stay the same.
Now it's time to be Joe Tyvied. My eyes are killing me. Ever since I got LASIK done, my eyes are just always dry. So, cultural change, it is hard. The more entrenched things are, the bigger the resistance. It's like a big snowball. You put a snowball at the top of a hill and it just sits there. But you have to give it a push, and it moves a little bit, and then you push a little bit more and it moves until finally it starts to roll down the hill. And then it just keeps going and going and going. So I'm really excited to be back here in Star Valley, and so I'm hoping that you guys are excited for me too. So please sign up and come to the Joe Ty presentation next month. Get with your department director. It would be great.
Thank you, guys. Okay, Anona, looks like you're up. You gonna top that?
No, I can't. That was fantastic. So I'm going to try and be fast on this, though. So since I get to do the morning pledge, everybody knows what that, everybody's been familiar with that. So when you come to work, every day when you come in, just really quick, give me some positive things that you guys bring to work.
a smile,
Okay?
enthusiasm,
Okay?
cheerful attitude,
Okay?
coffee,
Okay?
Pepsi.
Okay? What else do we bring?
Good attitude.
Okay?
knowledge,
Okay? What else? What?
patience,
Which one? Okay. What else do we bring here when we come in? To our job?
Willingness.
humor,
Okay. Okay. All right, so when I was told I needed to read this book again, I wasn't very happy. How many of you guys felt that way too when you were told you had to read this again? Nobody in this room? Nobody was resistant to reading this book in this room. Okay, my first thought was I'm going to have Joe Ty cram down my throat one more time. It was my first thing, and I don't need Joe Ty. I'm a good person. I come to work. I work hard. I think I'm positive most of the time. Try and treat people with respect, courtesy, kindness. Try and hold old people's hands. Do a good job. I don't need this. And then I was resistant to going to the group discussions until I get an email from my boss saying I had to go to 2. That made me angry. I'm like, oh, now I'm being forced, really forced. It wasn't a choice. So one of the first ones I went to, I waved the book and I said, this has not changed my life. This has not changed who I am as a person. And then I went to the next meeting, and then I got to thinking, well, this is actually changing my life. I am a good person. I do work hard, but I need my tank filled. I need something brought into me to make me feel better about what I do here. And this kind of helped open my eyes a little bit. It helped me learn about how I can speak out and get my voice heard. That I have a team, administration, the people that ran these group discussions, they all were willing to hear what we had to say. And what was kind of sad is some of those group discussions I went to, there was only like 4 or 5 people that even went. So I think a lot of us lost the opportunity to really go and hear. And we're supposed to, one of the things I learned was we're supposed to listen twice as much as we talk, and I think that was something that I learned too. But this really did change how I think I'm going to be at work and how I'm going to have a little more understanding and compassion, a little more loyalty. How when I do come to work, I'm not going to sit and gossip. And what can I do to fill my tank? I can't fill your tank if my tank isn't full. I've got to be able to take care of myself. And that's the only person I have control over, is me. I can't change other people. I need to change me. And I have some work to do. And this kind of helped me realize that. Even though I thought I was a good person, I think we all think we're good workers. We all work in a hospital. We come to work. We take care of people. Every department has a purpose, and we all do a good job. But we all could do a better job. And so I thought, when we leave here today and we go out of this facility, what can we do to make this place the best hospital that anybody could walk into? If somebody walks in off the street and comes in the front door, from the time they walk in until they get to where they're going, whether it be the receptionist, the billing department, the x-ray, the laboratory, the nursing staff, the housekeeping, no matter who they come in contact with, every one of us have that opportunity to make that a fabulous experience for people and make them want to come back. And we own that. We can do that. They can't do it. We can do this. And we need to. And I think when we go out of here at the end of the day, we need to think, did I bring this stuff, or did I bring negativity, gossiping, whining? They don't pay me enough to do that. It's not my job. Yesterday in the group discussion, they talked about what's in it for me attitude. And I thought, I do have that sometime. Like, how's that going to benefit me? And I think when I hear negativity, I think, well, all the money right now is going to the ER or the OR, so we're never going to get the equipment we need. Well, everybody's on a budget. These guys can't give money to every department for everything they want. So we have to realize that. And when I hear nobody cares, well, I care. So that doesn't mean nobody cares. I care. So I think we need to really kind of embrace this. Really reread it, in your leisure if you guys haven't done that. So the promise I want to read today is the Tuesday one. I think I kind of passed that around as accountability. So if we'd like to say that out loud. I will not allow low self-esteem, self-limiting beliefs, or the negativity of others to prevent me from achieving my authentic goals and from becoming the person I am meant to be. And so I would just challenge all of us that when we leave today, we walk out this door here, that we take out positivity and we take out what we can do to fix things, come up with solutions, come up with ideas. Go out of our normal job if we see something that needs done. And let's make this the best place anybody ever worked. Because on Facebook and in the paper, when people say, when they trash us, or they have had a bad experience, that's a reflection on every one of us. If somebody has a bad experience in this hospital, we work here. we're part of that negativity that gets out there. So let's not let that happen. Let's be great. We can do it.
Okay, Trevor, looks like you're up. Guess you gotta go up to the podium.
So, how many of you have heard of an exit interview? Okay, what's an exit interview? What's that? Okay, exactly. It's an interview you have when you're leaving your position. And a lot of times we'll do that as employers to try and figure out why people are leaving and try and figure out what we can do to keep them here. And so we're doing something a little bit different, and some people kind of laugh at the name of this interview, but whatever. We're doing a stay interview. So a stay interview is a little bit different. How many of you have heard of a stay interview before? Okay, the director should have, all right, because they've been trained on it. So a stay interview is an interview that you have with your employees when there's nothing wrong, or when they're not considering leaving, when they're still here in their jobs. And basically, it's a series of questions that your director will ask to get a better understanding of who you are and what things you like about your job, what things you dislike about your job, what things you aspire to do, what you would like to accomplish over the next little bit. And so a stay interview is a good opportunity for you as an employee to sit down with your director and have kind of a heart-to-heart discussion and give them real feedback on where you're at as an employee and the things that you would like to accomplish, the things that you'd like to do. So we're going to be doing that with all of our directors and with each of you. We hope that everybody has an opportunity to participate in one of these interviews, and it's going to be tied in with your evaluations as well. So you'll do the evaluations, and then you'll also do the stay interview. So I would just encourage you to be open and have that conversation with your supervisor. Give them the responses that you want to give them. Talk to them about the things that you're concerned about. Let them know what you would like to do to help keep you here as an employee. And I think it can be a really powerful tool. I've actually had several of them come through, and I appreciate the honesty on there. And it's been a good opportunity for me to read through and see what motivates people and what helps people to want to stay in their position, and what things we can do to improve the workplace for you. Because overall, we want to improve employee retention. You'll see as I talk in a minute about our focus and execute goals. That's one of our goals, is to improve employee retention. And we want to improve the experience that each of you have when you come here to work and make it a positive experience for you. So please look forward to that, and be honest and open with your supervisors as they come and do that with you. So get that. Then I don't think I can scroll down through this with the clicker, so I'll just do it from over here. So we each board meeting we talk about our strategic goals and where we want to be as an organization. And I don't know that we've really ever shared the strategic goals. Maybe we have, but it's not formally shared with each of you very often. So I think right now is a good opportunity to share with you the strategic goals of the organization, just give you kind of a feel for where we want to be and some of the things we want to accomplish over the next year. So this is for the 2016 fiscal year, which is from July 1st to June 30th. And these are the goals. So Charlie Button is over the goal of officially apply for Joint Commission accreditation. So that's going to be one of the goals over the next year. Provide formalized training plan for nursing staff, and we'd like to have that plan completed and 100% compliance with that plan. And I know Derek and Lauren have done a tremendous job with the nurse training, and Amy and Gloria as well with their nurses up there. So appreciate all that's been done so far. Another goal is the nurse retention rate, and we'd like that retention rate to be at 80%, and that's excluding retirement. So we understand there's some positive turnover that happens in an organization, and we're not concerned about that. We just want to focus on the retention rate. Total employee retention rate at 80% or above. And just to give you an idea of where we're at now, we're at our turnover rate, which would just be the mirror opposite of retention. Our turnover rate currently is about 26%. So if you think of that in retention rate, we want to have our turnover rate lower than 26%, so we have an 80% retention. We'd like to enhance wellness participation, have a goal of 70% enrolled in the wellness programs. Mike, do you know currently where we're at with our wellness enrollment?
I think we're at about 59%.
59%. Employee and facility safety, reduced back and sharps injuries by 25%. That's been an area of concern. We've had several sharps injuries and back injuries. If you look at our injury reports, those are up there on the list of injuries that we have. All staff participate in the department lead service projects, and I know many of you have done that, and we're going to go through some of those service projects. If you haven't done it yet, it's a great experience. Public relations, this is for Joel's goals. If we want to hear from you, the new website and community forums. I know he's putting a lot of effort right now into a new website, so that's going to be updated, and we'll have a new face there. So, patient portal, achieve meaningful use requirements, and I believe that's with the feedback we have to get from the patients. Establish and grow the cardiac rehab program. Goal to see 24 patients. It's 864 visits the first year of operation. ICU in operation. Expansion of infusion space and services to include the Cumulative Clinic. In partnership with the Cokeville Hospital District, establish the Cokeville Clinic. And I know we're well on our way there. We're going to have that up and running by the 31st of August. Functional, operational, and reporting of Meditech, new software access and training. Patient satisfaction improvements in all areas. Goal to achieve a minimum of 70th percentile ranking in all HCAPS, emergency department, outpatient services, and survey areas. ICD-10 implementation, no reduction in payment and no increase in AR days. Cost control, Denise is going to make sure that happens, right, Denise? Okay.
Absolutely.
Cost control, keep overall expense increase to no more than the increase in net revenue, and increase the foundation fundraising by 10%. So as you can see, we have a big year ahead of us. There's a lot of things that we're going to need support from each of you on. So I encourage you to visit with your director and see how you can help us to accomplish those goals. So if we can do all of that in a year, we're going to be a lot better off a year from now than where we are today. So
Why don't you talk about your employees?
it's it's not plugged in. So
Okay, so Bob, you're up.
Yes.
Just to let you know that at the end of this meeting, the last 10 or 15 minutes of it, we will have a pepper spray demonstration out on the patio here. We'll be using neutral ingredients in the demonstration, but we encourage you to come out. It could be a life-saving experience for you. And also the departments who responded to our in-house active shooter scenario concern. The Sheriff's Department will be working with us in our individual departments. Some of you have indicated that your own individual department staff meetings will have meetings in which we can include maybe a run-through in your department for each room, literally for each room, to show you how you can defend yourself in a very seemingly indefensible area. And then a word, as far as the Florence Principle is concerned, I think it might be hard for some of us to grasp what's being taught and what we can read, because it's something like the wind. You can experience it, but you really can't see it. In a way, it's just the opposite. Once you feel it, you can experience it. If everybody does their part and makes an effort to experience what they describe in here in this book as something that it's the invisible architecture of your building. Everybody's concerned about that visible, but the invisible is just as important, if not more so. This building has no meaning without that invisible architecture that you provide, the support that you provide for this business. Thank you.
Thank you, Bob.
Okay, I've got this up, Charlie.
Okay, go ahead, and then we'll do the service projects.
All right, so Tawny Kazir, and if you're here, we'd like to welcome you, so wave your hand and let us know you're around. Tawny Kazir, Environmental Services. Mason Johnson, I saw Mason. Welcome, Mason. You're working with the Maintenance Department. Stacy England, RN on Med-Surg. Christina Hill, a new search tech in the OR. And that's it.
Okay. Trevor, you in charge of the service projects?
No, but I can get it
Pam is.
going up there.
So these are those that have been completed thus far, and the first one we'll talk about is environmental services.
So 24th of April, we went to Beyond Home, and we made them dinner.
Could you speak louder?
So we made them dinner. My daughter played the piano for them. We have here just a few pictures. This little CNA that works there was dancing with the lady in the wheelchair. It was really super cute, but I didn't catch it. She didn't want me to take her picture. She was trying to get away from me. There's this cooking. Beth's doing green salad. Bob's cooking up sauce and breadsticks and serving them, talking to them. We had quite a bit of our crew here this night. I played, Bob and my daughters sang. I had a recording, but I couldn't get it to go on here, so. And then, I don't know how many of you guys know Don Sessions, but he couldn't help but flirt with Kanisha. And Don says, "How old are you?" And Kanisha says 19, and Don says, "Last time I dated someone that young, I couldn't decide whether to burp her or kiss her." And there's our group pictures, and then we did a funny face picture, and just my kitchen help down on the left there. We did formal introductions. We all introduced ourselves and met everybody over there. And then on the 19th, do you want to do this one, Bob? I wasn't able to be here. I was working nights, so Bob did this one down at Legacy.
Keep in mind that in Legacy, they not only have elderly people there, but they have people there who are struggling health-wise. And so when we visit a place such as this, we keep that in mind. Some of these people don't have a whole lot of contact with the outside world. And it's really neat to be able to open a door, even though it's for a short time. And we had one individual who just couldn't say enough about our taking time and the producing the energy, because everything that we did in both places, we cooked, and the way it's set up is that we cook in front of them. And so we can talk back and forth if they come a little early. And so the conversation is sometimes interesting, as Cynthia has indicated. Anyway, it was a lot of fun. We sang at this one as well. We did basically the same thing. We can
There's
go ahead.
pictures. You have it in your hand.
Oh, I'm
Right
sorry.
side.
Right side? Yep.
Yep.
This time, and one of the things, we didn't want to just serve anything. We wanted to serve things that they really enjoyed. I took the liberty of doing part of their menu this time. It was well received, but I could tell they liked things better, other things. Root beer floats, they actually drank with their meal, which was unusual, but that's what they're used to. They really enjoy it though. You can see one individual here, he's much younger than the rest. And he really appreciated it as well. We just during the time we served them, and after the performance, during the performance, we had people talking with them, letting them know that we cared. Here are Sandra, Marcella, and Veronica, and their children, Maximo, Misty. And they all kind of pitched in. We really had an enjoyable experience there. Pardon? Again, Mark. Jeanette Miller was the CNA at this particular place. I don't know the story behind some of these photos. We got a lot of that. Okay, I guess that's the end of it. Okay, thank you. It was really enjoyable.
So if your department's here, you want to pop in, please pop in and say something. I think we start with the lab, maybe. Is there anyone from the lab? So the lab decided to do emergency kits for people in need, and when they were done, they gave them to the sheriff's department, and I think maybe also the crisis center here. And here's a picture of them putting the kits together. They put little kits together for those that were in need, and they included blanket, shampoo, conditioner, washcloth, soap, deodorant, anything they'd need for an immediate assistance. And their comment was the team had a good time putting these together and had a great time assembling them. The next one was Kathy. Is she here? Is anyone from CS here at this time? Okay. Kathy, they decided they needed someone in CS, so Kathy chose to do, is she here?
No.
Oh, Teresa, pop up. Do you know anything about this?
I just know she did it in the rainstorm.
She did. She tried to wait for good weather, but she couldn't. So instead of brooming them off, she had to use that power spray. She went behind the caretakers after they mowed and cleaned off every headstone. And she actually did it in between the rain that day. It was in May when it was raining every day. She removed the clippings and she made them all really nice to prepare for Memorial Day. I think it's important to understand you can't live a perfect day without giving something to someone else that will never be able to repay you. And that's what she agreed with. There's a picture of the Bedford Cemetery. Her result, she lived perfectly. Next project was the surgery. Anybody here from surgery this morning? Okay. So they decided to clean the Veterans Memorial Park and straighten it up before Memorial Day too. So they went there and pulled out all the weeds and broomed it off and got it all ready so that they could plant new plants. And they did this in between the rainstorm too. I think they all did it one afternoon in between surgeries. And the comment was, we enjoyed laughing and talking and doing things that we don't usually get to do in the operating room. They felt like they really built their relationship together. We make a living by what we get. We make a life by what we give. They felt like they had another perfect day. So there's a picture of their completed project. And if you drive by, it looks beautiful. And I just wanted to thank those men and women that have served our country. Drug take back. Scott, you want to talk about that? They went to the Afton Senior Center, Salt River Center, and met with older people and went through every bit of their medication. And here's a picture of those that came and took advantage of that program. They didn't just take old medications, but they talked about what they took. The next one was the business service building. Anybody in BSC that would like to talk?
I'll just say, we just kind of, because when we moved over to that building, it needed a lot of grounds work, so we just tried to clean up all of the weeds and sprayed everything. Then we laid the ground cover down and kind of see here where everybody's working to put some little plants in along the way, and the ground cover, the rocks. Did a lot of the lawn, cleaning up where all the mice had eaten up, planted a couple of trees, put some flower pots in now. And we're still kind of trying to finish it up. On the other side, well, now there's work's finished with the pots. And on the other side, we're gonna put the gravel, and we cleaned all of it out. Bruce and those guys came and put in a water drip line through there to help with the little shrubs, so.
And I think the radiology department's gonna be doing something
And
with that
radiology
too.
is putting a picnic table over there.
Yeah. So administration and HR and, I missed all the others. I'm sorry, I'll go back, so I don't wanna miss any. Payroll, accounting, and all the quality. They came and helped us with Dawn McCaskill's house. We wanted to help serve her. Her and her husband have given to young people in the Star Valley area for 40 years in the old bowling alley, and so she couldn't paint her house and fix it up herself. We wanted to help her. So first thing we did is clear away all of the old brush from the house and take off the plastic around the windows, and our little project kind of turned out to be a lot more than we thought, but it was so rewarding. Everybody took time there, everybody. Even Amy was, when she was all laid up, she went over there and helped every bit as much as everyone else trying to clean up and help. So it took us several tries, and we had to fight the rain the whole time, it seemed like, but we put fascia around all the outside of the house, tried to fix the roof a little bit. Charlie looked at the fence and leaned on it, decided it needed some help. So we even had Jeff Paxton come help with the fence, and Charlie's son. So we put a new fence on one side of the house, and then we started the house itself. So we decided, she wanted it painted white, and then we said, do you want a trim color? And she said, oh, that's too much work. We said, pick a trim color. So she was so excited, and she would come out and say, oh, I don't know what to tell you. This is so wonderful. This is so wonderful. Randall really did help, but he was taking a break, checking on his workers. So I'm not sure what Layton was doing there. He'll have to explain that picture. Everybody at one time or another was on the ladders, in the grass, on the ground, helping paint the porch. I think we had a lot of fun together, and not only helped her, but it really built the relationship of all of us together, working as a team. We were so close there, and in a couple of days we had more rain, and we thought, oh, we're never going to get this done. We had to wait for quite a while to finish it. Up the day that we finally got it, that was a hallelujah day. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that has changed the world. And I have to tell you, Dawn came to a board meeting, very emotional. Not only at the help that we gave her, but at the help the nursing staff and everyone that started our medical center gave her during the time when Doug was passing on. So we just appreciate everybody for all that they did, and want you to know that those that haven't finished their projects, when you get them done, please send me your pictures, and we'll make another slide for the next meeting. Thank you.
I just want to say the service projects are being noticed in the community, so, and I think that who wins the most out of it is actually the ones doing the project. And that's the way I felt actually working on that house. And, yes, she wins. I mean, it was definitely a good thing to see her house transformed, but I think that the people working on it really got the most out of it. So. Okay, we need to keep moving on. Our time is rolling. So, Joe, looks like you're up.
First thing from the Wellness Committee, we just want to talk that we are continuing on with the evening hikes On July 30th, it's a Thursday evening, we meet here at the hospital at 5 p.m. and go do a hike. Your families are welcome to come. We're looking for a location in the lower valley, so if you guys have an idea, we've been looking at some areas, but the Forest Service say they're too difficult or they're going to take us too long. We don't want to spend the whole night, but just to get out and do some hiking. I know Mike and Chad and Trevor were the only ones that showed up to go up to Swift Creek, and they had a good time. I'm still trying to figure out who took the picture of that. And then on August 13th, we're going to go up to Cottonwood Lake. We're going to take a hike up there real quick, so that's coming up. Also, during the employee picnic that's coming up on August 19th, the Wellness Committee is going to have an obstacle course there for everybody to participate in as well. So it's going to be kind of a fun thing. Not for the super little kids, but probably your teenagers and adults will have a fun time on that one. Florence prescription sign-up sheets. All of your directors have sign-up sheets. As Joe talked about a little bit earlier and various people have introduced, on Thursday, August 13th at 10:30, 8:30, 10:30, 1:30, and 3:30. We have the 4 90-minute sessions going on in here, so please sign up. If you haven't read the book, please read at least the first 3 to 4 chapters. The story may seem a little hokey to you, but look beyond the story and look at the principles that it's trying to teach. They're all principles that we have, but this helps us be able to utilize them here in the organization to make things better for us. And then the foundation. First of all, I'd just like to say thank you to those that contribute to the foundation, and congratulations to those. This year the foundation received $4,000 from the Star Valley Medical Center employees, and we gave out 4 scholarships to some of the dependents of our staff. Brian Campbell, who is Ty Campbell out of the Lab Son, Jamie Klinger, which is Cynthia's daughter, Victoria Heap, which is Lanita's daughter out of Revenue Cycle, and Bronson Muir, his mom is Angie in the dietary, all received scholarship money for going on to college, which was really nice. Also wanted to let you know that the foundation achieved their capital campaign goal of raising $60,000 for 2014. All of that money is going to be used for renovating the labor and delivery and nursery rooms here at the medical center. If you go in, you can already see that the flooring's been replaced, which is really nice, and the windows, we've taken down some of the window treatments and have put up a film on there so that they can actually open the blinds, get fresh light in, and somebody can't peek in and see all that's happening in there, which is really kind of nice. Got a few other things happening, and that'll be going on as we've got time to do that, but that was really nice. This year, for the 2015 capital campaign, we're going to be raising $60,000 to purchase an additional ultrasound machine for the facility. With everything that we've got going on with ultrasound, and then adding the cardiac rehab and so forth, the vein mapping that Dr. Green does is just getting more difficult for patients, and they're having to wait longer and longer periods of time. So we felt that that was a needed piece of equipment for us. If you would like to donate to either the scholarship fund or to the foundation, I have some forms that I'll put on the table. You can do it out of a payroll deduction, and so it's tax-free for you. We give you a form at the end of the year so you can use that for your taxes as well. So appreciate it very much. Thank you.
Okay, just a couple of quick updates on number 1 is the ICU. Yes, it is coming. I know we've talked about ICU for quite a while now, and we've had some snags or hiccups, but we are on schedule now with October 1st as being our start of the ICU. And what's held us up is actually having a tele-ICU program of actually having other doctors be available, specialists. And we are now working on a contract with IHC out of Utah that will actually do that. They have a very robust program in place, and we're going to be the first hospital outside of their system that actually will use their telemedicine program, and they want to really open that up to other hospitals, but we're the first in that process, and that's why it's taking a little bit longer to do. And then Cokeville, just an update on what's happening with Cokeville. Our target date is August 31st to start seeing patients in Cokeville, and everything is falling into place. We have located a facility. It's actually going to be the Baptist Church in Cokeville. It's on the main drag on Highway 30 going through town. So we really like the location, and it's actually the facility itself is going to work out very well for us. So we've secured that, and then we're going to, we're working with Bear Lake Memorial on a provider, and that's going to be a physician assistant that's going to be splitting time with us in the Cokeville Clinic, and then also they're going to be doing some work at Bear Lake. So we're going to go that route because it's somebody that's known in the community, has a really good reputation. His name is Joe Dayton. He lives in Cokeville, so he does know pretty much everybody in town. So we're very fortunate that able to have him be our provider there. So we don't see any hiccups. There's a lot of work behind the scenes to get the facilities ready and the staffing to get it going, but we don't see anything stopping that progress. Okay, Mike, it looks like you're up for construction.
Good morning, everyone. Just a little bit of an update on the facility construction. As you know, the maintenance guys are like super busy right now with construction projects. Just to name a couple, the cardiac rehab is now completed, and I think Trevor's pretty happy to be in there. That turned out very nicely where the old HR offices were. They're near the medical office building, the clinic. That's turned out very nice. Right now, we're working on getting the new x-ray machine installed. And that's turned out to be a little bit bigger project than we originally planned. But it's working out. We should be in business again by the end of the month with a new x-ray machine. So that's going to be a really nice addition to the facility. Also, regarding the major construction project, the operating room and surgery department, we've run into just a couple of minor snags, nothing major, but it set us back a few days. We had planned to have the state inspectors here on the week of August the 3rd. They're pretty particular about when they can come. They only go out in the field every other week, and so we weren't prepared for them for August the 3rd, so they're not coming now until August the 17th. So we know we'll be ready for them at that time and get an inspection, and hopefully we'll be into the new surgery department, at least phase 2 of the project, sometime toward the end of August, and be doing business in there, and people will be able to go into the new outpatient surgery waiting area and admissions area to get their surgery services. So that'll be really fun and nice for our patients. The fireplace is finished it yesterday there in the waiting room of the outpatient surgery. Our surgeons have actually funded the cost of that fireplace, and it's really beautiful. So I would like to hear probably in about 10 days or so, maybe 2 weeks, I'll send out an email to all, and if there are folks interested in taking a tour of that space before we have it open for business, I'd like to offer that to everybody. Probably do it again on Friday afternoons and have a sign-up sheet and administration for you to be able to go and take a tour of the OR facility. So things are going really good, just a lot going on. Just ask Russ or Trent or Bruce or Sid or Mason how busy it is. Just lots to do, and try and cram it all into just a few months in the summer. There's a lot of outdoor construction work to do. So thank you. That's going really well. Just want everybody to know that the money is being spent wisely, and we're trying to provide a really great facility for our services here. Thanks.
Hey, Pam, you want to talk about the event? Cover all that?
I think we did everything but the picnic. Make sure you write on your calendars August 19th, Wednesday, for the employee picnic. It's for you and your families, and Joe mentioned a little bit of what's going on. It's going to be a great time, and we have outgrown the park. We are moving to Lincoln County Fairgrounds, so whether it's rain or shine, there will be bull riding. So, and I think we're going to have pulled pork and lots of activities. The spark plugs are hitting all of the activities, and so we so much appreciate that. But make sure you plan your calendar.
Okay,
for that.
Pam, you want to do a drawing, and then we'll turn it over to Sheriff Johnson.
Yes. So Anyone sitting on the front row today gets a prize.
Wow. Nice.
Let's see. Lauren Wire. Lauren, I'm today. Yeah. So if you're interested in doing the pepper spray demonstration, Lincoln County Sheriff's Department, we so appreciate Brian and Shane for coming, and they'll just be right out here on the grass on the side. It's National Ice Cream Month, so if you're not going to do the demonstration, just come to the ice cream cone. If you are, do the demonstration and then come to the ice cream cone. Thank you, everybody, for attending.
Okay, thank you, guys. Oh, hang on. Oh, we got one more thing.
We don't want to scare anybody with the pepper spray demonstration per se, unless somebody's willing to get pepper spray. We'll facilitate that. What we do have is some inert bottles, so we can show you how it works and how it's used without the downside of pepper spray. So we can give you an example of that. But really quick, I'm not sure how you want to do this, but we can do an example on that. But how many people are using pepper spray, or how many people carry it?
We've given it to any nurse that wants it.
Okay.
So there's trying to do it.
All right. So what we thought would be valuable is to give you just a little brief idea of the good things and bad things about pepper spray and what to expect and what not to expect if you pepper spray somebody. So I'm not sure how you want to do this. If you want to get the ice cream, and we can keep. Okay. We'll be brief. There's a couple things about pepper spray that are really good, and there's a couple things about pepper spray that you really want to be aware of if you use it. And so I don't know what instructions or what brief you got when you got issued pepper spray, but it sounds really obvious, but if you're chasing somebody with pepper spray and spraying, you're only pepper spraying yourself. And so that's one of the things to know about pepper spray is it is very difficult to control to the person that you want to pepper spray. So everybody around is going to get it, including you. If the likelihood of you pepper spraying somebody and not getting some residual pepper spray is very low. Do we know what kind of pepper spray you have? Is it a foam? Is it a streaming foam? Fogger?
There's different uses. So if you have like a foam, that's for like kind of close quarters because it just is on the person and it's foam. If it's like a fog, that'll like fog the whole room. But if it's a strain, that's for really accurate. And there's like a comb that can mist everybody too. So make sure you get some stuff that's going to be for you, personal use or whatever. You don't want to fog everybody when you use the pepper spray. So make sure you're aware if you're carrying the stream or the fogger, or because there's like 5 different types out there on the market. Stream.
Yeah, the kind we issued is a stream.
Stream, which is a good one to issue.
So do you know what if you do pepper spray somebody, what the target is that you're going for? The eyes. So it affects the mucous membranes, and so you're aiming for the eyes, and that's where it's going to have the most effect. Now, the reality is that it's very difficult to be accurate, so you're probably going to go past the eyes and get them, but if you focus on the eyes, you're going to hit the target. There are a certain amount of the population that's not affected by pepper spray, so you need to be aware of that. There's also a likelihood, if the person is intoxicated or heavily intoxicated, that it may not have the effect that you want it to have. And if they're taking a certain amount of drugs, that it may not, a certain type of drugs, and they're very highly driven. Even people can fight through pepper spray. If they're trained to do it and they're very motivated on hurting somebody, you can fight through it. So I want you to just be aware of what the expectation is when you use that it may not have the effect, the immediate effect that you want. Having said that, it may still affect you the way you wanted it to affect them if you get some. The idea here in this setting is if you get to that point where you have to use it, we hope that you're on the 911 line with us right away to get law enforcement here. You don't want to engage that person after you spray it because you will get it on you and it will hurt for a long time. The expectation is about an hour that you can recover from that with a lot of flushing of the eyes and face, and then you can expect when you get in the shower it's going to start all over again and hurt again for a while. The last time that I got pepper sprayed on purpose, it took me about 3 hours to fully recover. So it's a very effective tool in certain circumstances, and I would say in most circumstances, but the reality is that there are things you need to be aware of when you use it, and that's that you will affect others around you. So in a setting like this, if you were to pepper spray, the likelihood is all of us would be feeling that to some extent. And it's going to come to rest on furniture and other things, so there is going to be some a certain amount of residual pepper spray in the area that if you just come back in and sit and rub your eyes or wipe your nose, it's going to start all over again. So I know you're waiting for ice cream. What we do have is some inert pepper spray that we can go outside and allow you to, if you find somebody that's willing to do it, it will not, it's not the real, we do have real pepper spray too, if you want to try it, but you need to ask your supervisor for the next 3 hours off.
Okay, there's one more thing we left off the agenda we need to talk about, and that actually is under finance, and it says employee assistance fund through Friday, wear jeans and bring $1. This money will go to a special employee fund to help peers. So we were giving that money to the food bank, or bringing food, or giving $1 to wear jeans. So what we are going to do is, the food bank isn't in the need that they were when we started, so we are going to switch gears, and we would like you to bring $1 to wear jeans, and that money is going to be, we're going to have a small committee that will look out for the needs of individuals, of employees, and that money will be allocated to them. So that's a switch that we're going to be doing. Yes, Amy?
And that idea was brought out in one of the Florence prescription groups, right?
It was, correct, yes, yeah. So anyway, so starting Friday, wear jeans, bring $1, okay? All right, thank you guys for coming, and have ice cream. Yeah.
If you're interested in the demonstration, we'll just go out there on the grass. That'll be great.